know why payroll tax exists in the first place. Imagine taxing, penalising businesses for employing people. I mean, it has to be one of the dumbest taxes on the face of the planet. You go to the bother of giving someone a job, which they pay income tax for anyway, the employee. They put money into the economy, and the government just has to put its hand in the till again. And I didn't think it could get any sillier, but apparently it does, because New South Wales and Victoria are now going to start charging payroll tax on independent GPs. Now, the way it works at the moment is that someone generally owns a medical centre, the bricks and mortar shop front. They employ the receptionists, the nurses, and sometimes some staff doctors. And the owner of the medical centre pays their wages, and so they pay payroll tax for them. And then GPs, who basically operate as sole traders, then lease rooms from the medical centre out of which they see their patients. That's why you can go to one practice and find some doctors who bulk bill and others who don't. But now the revenue officers of New South Wales and Victoria have had the bright idea that they will charge medical centres payroll tax on these independent doctors. Now, the medical centres don't actually employ them full time, they're basically contractors, and yet the government wants them to pay up. Now, it doesn't take an economist to work out what that will mean. You will have to pay more when you go to the doctor, so the medical centre can cover the extra cost. Payroll tax is 4.48% in Victoria and 5.45% in New South Wales. It's a fair whack, and you can hardly expect the doctors or the medical centres to absorb the cost out of the goodness of their own hearts. They're just trying to make a buck like the rest of us are. It's just rank stupidity. The number of bulk billing doctors has been on the slide for some time because fewer medicine graduates are choosing to become GPs. And the federal government, well, they froze the Medicare rebate for the better part of a decade, so a doctor's income was effectively going backwards. This will discourage even more doctors from bulk billing and increase private consulting fees. Dr Rodney Aziz, who is a GP in Melbourne's Inner East, told the Sydney Morning Herald today that clinics would have to jack up out-of-pocket fees $15 to $20 to cover the tax hike. Professor Charlotte Hespy is the chairwoman of the New South Wales branch of the Royal Australian College of General Practitioners. She also runs a practice in Glebe in Sydney. She said her practice was already paying payroll tax for contractors and had to increase fees by $20 to pay the tax, as well as higher wages and power bills. Now, going to the doctor is a non-negotiable for a lot of people, particularly the elderly, who are trying to get by on the pension. And here we are in the middle of a cost of living crisis. So what do the state governments think they should do? Make you pay more for medical care. This is just cruel and utterly stupid. Every government bangs on about how they want to reduce the cost of living, but what have they done? Nothing. They're actually making the situation worse, and they're doing it through things like your power bills as well. Now, emergency departments are already at breaking point all over the country, and I'll show you a shocking case of how emergency patients are being treated with Caroline Marcus in just a moment. So where do the state governments think people who can't afford to go to a GP will go? Even more people with the flu or a chest infection or whatever it might be will clog up EDs because they'll go, well, that extra $20 is the difference between putting food on the table tonight or making it to rent day. So the governments will just create more problems for themselves. Visits to the doctor are down by 2 million this year in Victoria alone compared to before the pandemic. People are reportedly waiting months to go to the doctor and presenting with a cavalcade of issues because of the cost of living. According to online healthcare directory CleanBill, the average out-of-pocket cost of a visit to the doctor is currently about $40. You add another $20 to that, and that's a 50% increase. Do you really think people are going to hack that? I mean, all these delayed doctor's appointments will undoubtedly lead to later diagnosis of things like cancers and other chronic diseases. And where will those people wind up? In hospital, where the state government will have to pay for them anyway. They're simply shooting themselves in the foot. Now, I know Victoria is effectively broke and they're jacking up taxes left, right and centre, but if Daniel Andrews and Chris Minns actually care about reducing the cost of living, they have to reverse this absurd decision now.